Today we are going to look at the bones of the skull. So we'll look at the cranial bones first, and then we'll look at the facial bones. So as we look at the cranial bones, the bones which form the cranium, as we see the skull from its dorsal view, that's the rostral, that's the caudal aspect. So the cranium, which is located right here, the bones which forms that part of the skull, those are called cranial bones. Some of them they are paired, some of them they are unpaired. So first of all, let's start looking at the occipital bone. As we see the caudal view of the skull now, that forms the base of the skull. The apex is located at the rostralmost end. So base of the skull, we see the occipital bone. In this particular preparation, it has been colored in red. So we see right from here, extending on both sides, that is your occipital bone, and we go slightly on the ventral aspect, you also see part of the occipital bone there. So dividing that into different parts of the occipital bone, we will see that is supra-occipital part of the bone, which is unpaired. Then we have exo-occipital part of the bone, one on each side, and then we have basi-occipital part of the bone, which is present on the ventral aspect. Important features of the occipital bone, we see the nuchal crest. Then as we come further down, we see a big opening right here, that is your foramen magnum. On both sides of the foramen magnum, you see the condyles or articular areas, those are the occipital condyles. As we go further down, we see the basi-occipital bone. As we go to the basi-occipital bone, we see these two smaller openings, these are hypoglossal canals. And so these are the major parts of the occipital bone. The part which is paired is exo-occipital. Remaining two portions of the occipital bone are unpaired. We're now going to look at the parietal bones. Parietal bones are located on both sides, and so it is paired. So parietal bone on the right as well as parietal bone on the left, and we have in between those two, we have the interparietal bone located, which is colored black in this particular specimen. Seen from the lateral view, we can see the interparietal bone. Again, going back to the dorsal view, we can see the parietal bones on both sides. Present on both sides, specifically on the dorsal as well as lateral aspect. So these are the parietal bones located on the dorsolateral aspect, forming most of the part of the roof of the cranium. These are the major bones involved in the formation of the calvaria or skull cap. Along the midline, there is a crest, that is the external sagittal crest, which would be continued further backward by means of interparietal bone. Another important feature of the parietal bones is the process which extends from the parietal bone into the cranial cavity. The structure is called tentorial process. The function is to separate cerebrum from the cerebellum. Cerebrum of the brain is located in more rostral part of the cranial cavity, while cerebellum is located in more in the caudal part of the cranial cavity. Okay, so this is part of the parietal bones, that is your tentorial process. Now let's look at the frontal bone. The orange color bone in this particular specimen, this is also a paired bone. So the bone is present on the left side as well as bone is present on the right side, articulated with each other along the midline. So the major aspects or major features of the frontal bone in the dog, we see the zygomatic process of the frontal bone, one on each side. The orbital ligament is going to be associated with that. On the dorsal aspect, we see this flat part of the bone. The portion which is more rostral is called frontal squama. This is the portion of the bone which is located subcutaneously. Going along the frontal bone, so we see from the external sagittal crest, two lines are diverging from each other. Those are the temporal lines. Into the cavity of the frontal bone, in this particular specimen, the frontal sinus is exposed. So we have lateral compartment, medial compartment, as well as rostral compartment of the frontal sinus. We can also see turbinate part of the ethmoid bone projecting into the frontal sinus. So that is the frontal sinus. In the dog, it is compartmentalized. In the cat, it is not compartmentalized. So the frontal bone, again, from the lateral view, we see the orbital part of that as well as the temporal part of that, the frontal squamor, the zygomatic process of the frontal bone, and we already have seen the frontal sinus. Now let's look at the bones which are present along the floor of the cranium. So seen from the ventral view, we see two bones demarcated from each other here. The bone located more caudally as well as bone which is extended further more rostrally. From the ventral view, we only see very little part of that, but then the bone is present more on the inside as well as slightly expanded further on the lateral aspect. So let's look at the colored skull. So we see the caudal part which is in blue color, that is the basis sphenoid bone, and further extension that we see along the midline, that is your presphenoid bone. Both of these bones are present along the floor of the cranium. They also have some important foramina associated with them, the basis sphenoid and presphenoid. From the ventral view, we only see little part of the presphenoid bone, but remember your presphenoid is further extended more laterally also. So we have presphenoid as well as basis sphenoid bone. Basis sphenoid is also expanded further laterally and it reaches all the way up to the temporal bone and frontal bone. So that is the wing of the basis sphenoid and that is the body of the basis sphenoid. Presphenoid, only small portion of that can be seen. As we go more laterally, we can see the presphenoid bone extended further up to this point, while basis sphenoid expanded further up to the temporal and frontal bone. Let's try looking at these bones from the inside of the cranial cavity. As we have removed the skull cap, we can now see floor of the cranial cavity. Here we have highlighted a bone located more rostrally, right behind the ethmoid bone, where we can see the cribriform plate of the ethmoid bone, and right behind that we have the presphenoid bone. There are two foramina associated with that, one on each side. Those are going to be the optic canals. Coming further backward, we can see the basis sphenoid bone, which has wings expanded further on both sides. So from the inside of the cranium, we can see the presphenoid and basis sphenoid. Here we can observe much more part of the presphenoid bone as compared to what we saw from the ventral view. Okay, so these two bones are unpaired bones. They form the floor of the cranium. Behind the basis sphenoid bone, we have the basioccipital bone, which is located more caudally. The next cranial bone is the temporal bone. As we see the skull from the lateral side, the bone which is highlighted in light blue color, that is the temporal bone. Seen from the dorsolateral aspect, we can see the squamous part of the temporal bone with external acoustic meatus associated with that, as well as the tympanic bulla associated with that. Extended more rostrally, that is the zygomatic process of the temporal bone. As we come further down, seen from the ventral view, that is the mandibular fossa of the temporal bone. As the squamous part of the bone can be seen from outside, to see the petrosal or petrious part of the bone, we have to see it from the inside of the cranial cavity. So the part that we see on both sides of the basioccipital bone, as well as which is located slightly more caudal to the basis sphenoid bone, that is the petrous or petrosal part of the temporal bone. So the one on this side as well as on the other side, that is the petrosal part of the temporal bone. While from outside, what we see is the squamous part of the temporal bone with external acoustic meatus, the tympanic bulla, the mandibular fossa, and the zygomatic process. The ethmoid bone. To see the ethmoid bone, we'll have to see the ethmoid bone from the cranial cavity, as we are now looking at the chordodorsal view of the skull. After removal of the skull cap, we can see this porous bone, the bone which is located along the median plane and distributed on both sides of the median plane, located more rostrally in the cranium. This porous part, or the part with a lot of perforations, that is the cribriform plate of the ethmoid bone. There is another part associated with the ethmoid bone which is called perpendicular plate of the ethmoid bone. Now if I try to see the nasal cavity, if I try to see it from the rostral view of the skull, then I can see something which resembles the nasal septum. That plate here is the perpendicular plate of the ethmoid bone. Okay, now let's move on to the bones of the face, or the facial bones. From the lateral side, we can see incisive bone located between the nasal and the maxilla, extended further rostrally. The bone has sockets for the incisor teeth, as well as in between the incisive bone and the maxilla, we have socket for the canine tooth. Seen from the dorsal aspect, both of the incisive bones are articulated with each other along the midline. Seen from the ventral view, we see the incisive bones extended that far backward. The nasal bones can be seen from the top, from the dorsal view of the skull again. We see the bones which are highlighted in green color. Those are the nasal bones. In this specimen, one of the nasal bones is broken. We see a little gap there, that is because of lost part of the nasal bone. So we have nasal bone located on both sides, laterally associated with the incisive bone as well as the maxilla. The maxilla or maxillary bone, part of the bone can be seen from the lateral view as well as from the dorsal view. Let's look at the bones from the dorsal view first. So we have bone extended from the frontal bone all the way to the incisive bone. The bone which is highlighted in light blue color, that is the maxilla or maxillary bone. From the ventral view, we can see the extent of the maxilla up to the ventral midline. Rostral to the maxilla, we have incisive bone. Caudal to the maxilla, we have the palatine bone. So we see those sockets for the maxillary teeth which are present within the maxilla or maxillary bone. We can see from the chordodorsal aspect, part of the maxillary bone is located here, which is related to the palatine bone as well as to the zygomatic bone and the frontal bone. The passage that you see here is the infraorbital canal. So we see the infraorbital foramen located on the maxilla. The infraorbital nerve and blood vessels are going to pass through the infraorbital canal, and they will become superficial as they pass through the infraorbital foramen. Okay. So the major part of the maxilla or major structures associated with the maxilla are the infraorbital canal, infraorbital foramen, and part of the nasolacrimal canal is also present within the outer lamina of the maxilla. In this particular preparation, we have this metal wire passing through the nasolacrimal canal. The next bone is the lacrimal bone, which we can see right here. The metal wire is passing through the nasolacrimal canal part of the canal is present in the lacrimal bone, while rest of the canal is present within the maxilla. Caudal to the maxilla, we have zygomatic bone. The zygomatic bone is located more on the caudal aspect of the maxilla as well as more laterally. Along with the zygomatic process of the temporal bone, the zygomatic bone forms the zygomatic arch. The process which extends further backward is called temporal process of the zygomatic bone. This is called frontal process of the zygomatic bone. In the cat, that is going to be much more prominent. This part of the zygomatic bone is called infraorbital margin, which forms part of the orbit. Going back to the ventral view, we can see the palatine bone. Part of that is located more rostrally, but then also has some more extension on the caudal aspect, which is located ventral to the frontal bone. This is part of the palatine bone as well. This is part of the palatine bone, and this is part of the palatine bone. More backward to the palatine bone, the bones which are highlighted in blue color, these are the pterygoid bone. Pterygoid bone on the right side, pterygoid bone on the left side.